One of the most common questions I get asked by my patients is whether estrogen is safe or not. And the answer to that, most accurately, is it depends. When we talk about estrogen safety today, a lot of what we know comes from a study done in 2007 called the ESTHER study. This study helped us learn that estrogen safety wasn't just dependent on the hormone itself, but on the way it was delivered. Hi, I'm Dr. Yadawar. I'm a board-certified OBGYN specializing in the care of menopausal women, and I've been prescribing all forms of hormone replacement therapy for the past 30 years. My hope is that by the end of this video, you'll understand the different routes of administration of estrogen and the safety profiles of each so that you and your doctor can decide what's right for you. Before we discuss the ESTHER study in detail, you need to know that the majority of the studies done on estrogen had been on oral estrogen only, including the Women's Health Initiative. Back to the ESTHER study. The ESTHER study was a large, multi-center, case-controlled study published in 2007. This study looked at postmenopausal women aged 45 to 70 and specifically looked at the risk of blood clot. It compared the risk of blood clots in women taking oral estrogen versus the risk of blood clots in women taking transdermal estrogen. The key question of the whole study was whether there was a difference between the clotting risk of oral estrogen versus transdermal estrogen. The ESTHER study had two key findings. One was that women using oral estrogen had a significantly higher risk of blood clots, while women using transdermal estrogen had no increased risk of blood clots at all. This study is a landmark study and changed modern menopausal care. When we take a medication by mouth, it doesn't get absorbed directly into the bloodstream. It goes through the liver first. The liver helps break down food, toxins, and medications. So before a medication circulates through your body, it's first processed through the liver. This is called the first pass effect of the liver. Another one of the liver's jobs is to make proteins that help our blood clot when needed, and also make the proteins that help it thin back out when that's not necessary anymore. When your liver sees the surge of estrogen after taking oral estrogen, it produces more of the clotting proteins and less of the proteins that help thin out your blood. Therefore, your blood is more prone to clotting. Conversely, transdermal estrogen bypasses your liver initially and enters the body slowly and steadily. Because your liver isn't exposed to the large surge of estrogen, it doesn't ramp up the clotting proteins. Transdermal estrogen exposure to your body mimics more of how your body's used to seeing estrogen when it was made by your ovaries. In medical terms, we say that transdermal estrogen bypasses the liver's first pass effect. By bypassing the liver, less clotting factors are made. Less clotting factors mean less clotting. In addition, there's less of an increase in triglyceride levels as well. The ESTHER study confirmed earlier studies and solidified transdermal estrogen as a preferred option for most women. It showed us that estrogen can often be used safely, but that the delivery method is very important. So not only should you discuss whether you use estrogen, but how you use estrogen, and that should be a shared decision-making process with your doctor. The ESTHER study showed us that it wasn't estrogen that was unsafe, but it was the delivery method that made it less safe. And it taught us that women should be offered an individualized approach to menopausal care rather than a one-size-fits-all approach. Thank you so much for spending time with me today, and I hope this video was valuable to you. If you're interested in learning a little bit more about vaginal estrogen, I've recently done a video on that, and I will link that right here.